Nathan Urbanek, and this is my first persuasive speech. What do you think of when you hear the Star Spangled Banner? Well, I think of soldiers fighting for their lives and the United States' freedom. Now, what if I told you these soldiers are now unemployed, homeless, and suffering from depression? According to Shortchanging America's Veterans, Nothing New, by James W. Beadnell, since soldiers have served in the Army, our veterans have had to suffer varying degrees of cold-hearted bias inflicted on them by the very nation they so honorably fought for. According to the CQ researcher, September 6th, Army Reserve Joshua Ombig, 22 of Grundy, Iowa, commits suicide after an 11-month tour in Iraq. His parents say he was suffering from post-traumatic stress disorder. According to Virginia study finds, rural veterans in poor health, a study of more than 767,000 veterans by Veterans Affairs researchers shows those rural areas are in poor health than urban parts. This study also included the 767,000 veterans who used healthcare. I'm going to explain to you why there should be more healthcare available to wounded veterans, who is making this a short-changing policy for veterans, and some solutions to help our veterans out. First is why wounded veterans should get more healthcare. Like Joshua, I just talked about, he put his life on the line, and just being in the war made him go crazy. So these men that survive can go through all the bad memories of seeing their best friends die and fight for their life should be rewarded. They should get at least enough money to survive. Some veterans are making as little as $26,000 a year, and income and other restrictions limiting health care, and the Veteran Affairs turned away $200,000 last year. These are wounded soldiers. They may be disabled, paralyzed, or maybe even mental illness from fighting for our country, our rights. Americans war veterans that have come home from sacrificing their country have had to face disease, depression, social denial, and hostility. Military surgeons are having more lives than ever before, but when they return home, they have to wait many months for treatment or benefits. Some even have bonuses held after wounds force them out of active service. The VA healthcare budget is such political bad news that the Bush appointees who run the veterans agencies won't even comment on it. This makes you wonder who is responsible for this. Second is who is shortchanging veterans of their health care. According to New Jersey Healthcare Network Home, the U.S. Department of Veteran Affairs Veterans Healthcare Network provides full continuum of care to our nation's veterans. This is obviously not enough to especially the wounded ones. According to Funds for Healthcare of Veterans, $1 billion short, by Thomas B. et al., the Bush administration acknowledged that veteran groups seeking funds for healthcare is short $1 billion for covering current needs at VA. This angered Senate Republicans who have voted down Democratic proposals to boost VA program at political cost. The organization Disabled American Veterans has been helping the U.S. Congress to figure out what kind of benefits they may get and how to apply for some. An army of U.S. veterans, more than twice the size of the Operation Iraq Freedom, have lost their health insurance benefits since Bush took office. According to Veterans Face New Fight to secure government benefits, as many as 500,000 vets are homeless since Bush came in. The Veteran Affairs Department serves 6 to 7 million veterans alone. This system needs help. It wasn't designed to handle this many people. The Congress needs to pass the bill that indicates that wounded veterans should be getting more health care, but also that the veterans should be getting more health care to at least get off the streets into a decent, comfortable, and secure home. The government to whom they risk their lives will help, but only after agonizing waits. There are too many veterans, and the Department of Veteran Affairs has too few resources to help them all. Third are some solutions to help our veterans out. Congressman Steve Rothman voted this week to eliminate a small portion of the tax cut for individuals making over $1 million and to use the funds to improve veterans' health care programs. Senator Dodd spoke at a Connecticut Disabled American Vets annual convention to thank veterans, and he has proposed legislation to provide funding for shortfalls in current health care resources for wounded combat returning. I think a good way to help our veterans would be from every high school, college, and university to donate and give a fourth of all the proceeds to the VA. We could contact Kimberly Allen, the communications director for Congressman Rothman. If every school would take a little income from sport activities, their apparel, bookstore, cafeteria, I think schools could easily come up with enough money to donate to the VA. There are veterans in every town. Why wouldn't the local schools want to help? There are the people closest to them and who risk their lives for them. People should have a good heart towards veterans who help them gain all of their rights. In conclusion, have you ever had a close family member, friend, or even a significant other go to war? Wouldn't you just be feeling terrible if after the whole time you were worried about them being in war, they became injured, and when they came home, they were homeless? I explained to you why there should be more health care available to the wounded veterans, who is making a short-changing policy for veterans, and some solutions to help our vets out. Remember Joshua Ombig that didn't even make it out of Iraq? Think of these veterans. Their lives are at risk 24 hours a day, and if we can't pay them some respect for at least finding them a home, then their freedom, then why are they fighting, or does it mean much to them? Why should they fight for us when they don't even get a healthy living lifestyle?